The ER doors burst open just past 3 a.m. A body on a stretcher, riddled with bullets. 20 gunshot wounds, no pulse. The trauma chief shouted. The room froze. Even the monitors seemed to hold their breath. But what happened next made everyone question everything they thought they knew about miracles. Then a voice cut through the chaos. Move! Nurse Lena Cross, the quiet rookie everyone called the new girl, was already gloving up. She didn't ask permission. She didn't look scared. Her hands moved like muscle memory from a life she never talked about. The surgeon said, Call it, he's gone. But Lena pressed harder and whispered, Not while I'm still breathing. Then, one single beep. A heartbeat. The impossible. By morning the story exploded across the hospital. The rookie nurse who saved a Navy SEAL with 20 bullet wounds. But when the FBI showed up the next day asking questions, what they discovered changed everything. Because some secrets don't stay buried when lives are on the line. Level 1 trauma alarm, 7:48 p.m. sharp. Multiple gunshot wounds inbound. The doors slammed open to pure chaos, blood, radio chatter, the smell of combat inside a hospital. Patient 1, male, late 30s, Navy SEAL, 20 bullet wounds, vitals crashing. The medics were shouting, the doctor already shaking his head. He's not going to make it. But in the middle of the noise stood one woman, calm, gloved up before anyone told her to move. Nurse Lena Carter, first-year staff, the kind of nurse who carried silence like armor. BP 70/40, pulse weak. Blood pouring from his side, chest, leg. Some wounds old, some fresh. Whoever he was, he'd survived hell before. The surgeon barked. Step back, nurse. She didn't. Her eyes traced every bullet path like she was reading a map only she understood. We can't cut yet, she said, calm, sharp. Touch that artery and he's gone. The monitor screamed flatline. Paddles ready? Lena's hand shot out. Wait. She pressed 2 fingers between his ribs, angled just off the heart. A move no civilian nurse should know. Seconds stretched. Then beep, beep, rhythm back. The doctor stared. What did you just do? She didn't look up. Bought him minutes. Used them. Hours bled into minutes. By 9:30 p.m. His pulse was steady, but fading again. The surgeon gone, Lena alone with the man who wasn't supposed to live. Don't you dare give up, she whispered. Her fingers brushed an old scar on his shoulder, 3 small burns in a triangle. Her chest tightened, induced. She knew that mark. His blood wasn't clotting. She pulled 2 unmarked vials no one else would touch, drew the mix, injected. Vitals spiked, heart rate climbed, pressure rose. The team stared. What did you just give him? She capped the syringe. Something they don't teach in nursing school. By 1:42 a.m. the ER finally went quiet. 9 patients, 9 saves. The chief surgeon muttered. Who is she? Night shift shrugged. Just started last month. No family, no social media, keeps to herself. The chief frowned. People like that don't just appear out of nowhere. Morning headlines hit. Rookie nurse saves 9 in one night, including decorated Navy SEAL. Reporters swarmed. Lena walked past them, head down, clocked out like nothing happened. As she stepped into the parking lot, 2 black SUVs pulled up. Badges flashed. We're here for Nurse Lena Carter, the clerk asked. What's this about? The agent smiled tight. Because we checked our records, and there's no nurse by that name in the system. Some people don't just carry secrets. They carry whole wars inside them. If you think we should never judge a book by its cover, comment, never judge, below. Because the quietest person in the room might be the one who already gave everything to keep the rest of us breathing. Subscribe right now, because this story is about to go places you won't believe.